Now, headlines from around the uniformed services community presented by the Military Officers Association of America. President Trump signed an executive order establishing a military spouse commission to address challenges faced by service members' families. The commission, chaired by Jennifer Hegseth, is made up of spouses of senior military officials and the spouse of the Secretary of Homeland Security. The aim of the commission is to develop policies addressing persistent areas of concern for military families, including housing, employment, healthcare, education, and deployment-related support. While a recent focus on quality of life issues resulted in a 2025 pay raise for junior troops, the strain of frequent PCS moves, access to affordable childcare, and spouse unemployment rates upwards of 20% have been among the most persistent issues facing military families. MOAA has long been a champion of military spouse and family issues. Reauthorizing the Work Opportunity Tax Credit, or WOTC, and adding military spouses as an eligible group remains a top concern, and it is one of the primary issues for MOAA's summer advocacy campaign. WOTC is a proven strategy for reducing unemployment. When the credit was extended to veterans, post 9/11 veteran unemployment dropped from around 15% to a rate comparable with the civilian population. Spouse employment affects stability, readiness, and retention. If families are under financial strain, they may opt to leave uniformed service. WOTC expired in 2025 and is awaiting congressional action, and lawmakers need to hear from service members and their spouses about how this affects them. Another important issue in MOAA's advocacy campaign is restoring GLP-1 coverage for TRICARE for Life beneficiaries, which was cut in August 2025. These drugs have been covered through the TRICARE pharmacy program since 2021, specifically for obesity-related medical conditions, not cosmetic use. Removing seniors but allowing prime and select beneficiaries continued coverage turns the program into a two-tiered system, or as one TRICARE for Life beneficiary said, that's TRICARE for some. For many affected beneficiaries, this issue is about more than a prescription. It is about preserving access to treatments that improve their health and honoring commitments made to military retirees. Speaking of GLP-1 drugs, the VA announced a trial to evaluate whether certain GLP-1s can treat alcohol use disorder. The study, known as the Cessation or Reduction of Alcohol Consumption in Veterans Trial, will enroll more than 600 veterans at 18 VA medical centers nationwide. Participants between the ages of 18 and 80 with moderate or severe alcohol use disorder will receive weekly injections of either semaglutide or a placebo over a 24-week period. Researchers will track changes in drinking, health, and quality of life to determine whether the medication offers a meaningful new treatment option. Recruitment for the trial has begun, and veterans interested in participating can visit their local VA or visit clinicaltrials.gov. The VA also recently announced a trial to evaluate whether psilocybin, the psychoactive compound in magic mushrooms, could be effective and safe to treat depression and PTSD in veterans who have not responded to other treatments. The trial follows the recent executive order by President Trump to increase clinical trials and research for various psychedelic drugs and mental health. According to a VA press release, the trial will be conducted in a safe, controlled clinical setting using pharmaceutical-grade drugs under careful quality controls, stringent safety protocols that were developed with FDA, and in a setting that includes psychological support. The VA strongly discourages self-medication in place of medical treatment. For more headlines affecting the uniformed services community, visit MOAA.org/news.